Welcome to the deep dive. Today we're diving into an area of canine neurology that might change how you approach certain cases.
Oh, definitely.
We're talking about the aberrant migration of Spirocerca Lupi to the spinal cord.
Fascinating stuff.
We'll be exploring a landmark study from the veterinary journal that's just packed with clinical insights.
Yeah.
So get ready to find out what factors determine a dog's chances of recovery and what role preventative treatment plays in all of this.
It's really a fascinating area of study.
It is.
Typically, Spirocerca lupi, is associated with esophageal problems in dogs.
Right.
Like those granulomas that can lead to regurgitation and things like that.
Exactly.
However, in this deep dive, we're going to be focusing on those rarer cases where the larvae migrate to the spinal cord.
Right. And to guide us through this complex topic, we've got a recent study from the veterinary journal.
Yes.
To dissect by Casoy et al.
Yeah.
This study provides, I think, the largest data set to date on this condition.
It does.
It analyzed data from 284 dogs diagnosed with spinal Spirocerca Lupi,
Whoa.
or SSL for short.
That's a lot.
It is a lot.
Yeah.
So this is a game changer.
Absolutely.
Yeah.
The researchers were very meticulous. They documented each dog's clinical presentation.
Right.
They analyzed their cerebrospinal fluid, and they even investigated the role of preventative treatment
Wow.
in these cases.
That's great.
Yeah. But before we delve into the study itself,
Okay.
it's essential to kind of understand the typical life cycle of Spirocerca lupi.
Okay, so let's rewind a bit. Could you just walk us through the usual life cycle of Spirocerca lupi
Sure.
and how it typically affects dogs?
Yeah, certainly. So the Spirocerca lupi life cycle begins when a dog ingests a dung beetle
Okay.
carrying the S. lupi larva.
Oh, wow.
Yeah, these larvae migrate from the dog's stomach to the blood vessels.
Interesting.
And they eventually reach the aorta.
Okay.
Typically, they then burrow into the esophageal wall where they mature and cause those esophageal granulomas we mentioned.
Right. So essentially, that's the typical S. lupi story. But today's deep dive focuses on those unusual cases where the larva deviates from this path and end up in the spinal cord.
Exactly.
What clinical signs should vets be aware of? What did this study reveal?
So the study found a wide range of neurological symptoms in dogs with SSL.
Okay.
These can include things like back pain,
Okay.
ataxia paresis, which is weakness,
Right.
paralysis, and even urinary incontinence.
Wow.
Yeah, to categorize the severity of the neurological signs, they used a grading scale from 0 to 5,
Okay.
with a 0 representing a normal neurological exam,
Okay.
and 5 indicating paraplegia with no deep pain sensation.
Got it. So based on that scale, how did the initial severity impact a dog's chances of recovery? Is there any correlation?
Yeah, there was a strong correlation
Right.
between that initial severity grade and the likelihood of a positive outcome.
Okay.
Dogs with mild symptoms at presentation were much more likely to recover fully.
Right.
However, even dogs presenting with severe paralysis showed potential to regain mobility.
It's encouraging.
Yeah.
You mentioned earlier that CSF analysis is crucial in diagnosing SSL.
Yes.
Could you elaborate on why that is and what the study revealed in this area?
Sure. So CSF analysis is critical because it can help us detect eosinophils.
Okay.
Eosinophils are a type of white blood cell
Right.
that often elevate in response to parasitic infections.
Okay.
Finding a high percentage of eosinophils in a dog's CSF points very strongly towards a parasitic infection.
Yeah.
And in an endemic area,
Right.
SSL is a top contender.
Yeah, that makes sense.
Yeah. In fact, in this study, all of the dogs that were diagnosed with SSL had more than 3% eosinophils in their CSF,
Wow.
which really helped solidify the diagnosis.
Yeah, so finding those eosinophils in the CSF really confirms the suspicion of SSL
Absolutely.
based on the clinical signs.
Yeah.
Did the study reveal any other notable findings in the CSF related to a dog's prognosis?
Yes. One really crucial finding was that dogs who recovered tended to have lower protein concentrations in their CSF at presentation.
Interesting. So could the level of protein in the CSF potentially serve as a prognostic indicator, helping predict the likelihood of recovery?
That's the burning question.
Yeah.
This initial finding certainly suggests that it could be a positive sign.
Right.
But more research is needed to really confirm this.
Now, I know some vets recommend regular preventative treatment with medications like doramectin or ivermectin
Right.
to protect dogs in areas where Spirocerca lupi is common.
Yeah.
Did the study shed any light on the effectiveness of these preventatives, specifically relating to SSL?
It did, and the results were really intriguing.
Okay.
Significantly fewer dogs receiving preventative treatment were diagnosed with SSL compared to the control group.
Interesting.
So this suggests that these preventatives might offer some protection against the parasite migrating to the spinal cord.
So there's a potential benefit, but it's not a foolproof guarantee. What about dogs who had already developed SSL? Did preventative treatment play a role in their recovery rates?
The study found that once a dog had developed SSL, whether or not they were on preventative treatment didn't significantly affect their recovery rates.
Interesting. So preventative treatment might help reduce the risk, but it doesn't necessarily alter the disease course once that parasite has reached the spinal cord.
Right.
What was the typical treatment approach for SSL in this study, and what were the overall outcomes?
So the treatment involved a multi-pronged approach. First, they used anthelmintic medications like dormectin or ivermectin to kill the parasite.
Makes sense.
And then they also administered corticosteroids like prednisone to reduce inflammation in the spinal cord.
So I imagine supportive care also played a vital role.
Absolutely. Supportive care included antibiotics to prevent secondary infections, pain relief medications to ensure the dog's comfort, and physiotherapy to help them regain strength and mobility.
That's great.
Yeah.
That makes sense.
The overall outcome was really encouraging. After 3 months of treatment, 75% of the dogs with SSL had a positive outcome. Meaning they were able to walk normally and they had normal reflexes.
That's fantastic news. I'm assuming the recovery time varied depending on the initial severity of the symptoms.
Yes, you are correct. Recovery time was definitely linked to that initial severity. For some dogs, particularly those with mild symptoms, significant improvement was seen within a month. However, for others, especially those that were initially paralyzed, it took up to 3 months or even more to see substantial progress.
So it sounds like a long and challenging journey for both the dogs and their owners.
Absolutely.
Did the study pinpoint any specific factors that influenced the likelihood of recovery?
Yes, it did. We've already talked about that link between the initial severity and the outcome. But the study also highlighted 2 additional prognostic indicators.
Okay, I'm all ears. What were the other factors?
Well, first, dogs presenting with urinary incontinence were less likely to experience a full recovery. This is likely due to more extensive spinal cord damage, affecting those pathways that are responsible for bladder control.
That makes sense. Were there any other factors identified in the study?
Yes. The number of limbs affected at presentation was also correlated with the outcome, as you might expect. Dogs with more affected limbs had a lower likelihood of regaining full mobility. Dogs with only 1 limb affected had a 76% chance of a positive outcome at 3 months, while those with 2 or more limbs affected had a 71% chance. And quite remarkably, all of the dogs with no limb involvement, meaning they just presented with back pain, achieved a full recovery at both 1 and 3 months.
This study is truly groundbreaking.
It is.
It sounds like early intervention and a comprehensive treatment approach can make a world of difference for dogs with SSL. Is there anything else about this study you'd like to highlight before we move on?
Absolutely. It's important to note that the researchers were incredibly thorough in their diagnostic approach. To be included in the SSL group, dogs had to present with clinical signs of acute and progressive spinal cord disease. However, ruling out other potential causes was really critical.
So how did they ensure that the dog's symptoms were truly due to Spirocerca Lupi and not something else? Did they use a combination of diagnostic tools?
Yes, precisely. They use a combination of CSF analysis, serology, and MRI.
Got it. Can you tell us more about these specific diagnostic steps?
Sure.
And what the researchers observed? What exactly did they see on MRI in these dogs with SSL?
Of course. So in addition to a thorough neurological exam, all dogs underwent CSF analysis. Finding more than 3% eosinophils in the CSF was a big indicator pointing towards a parasitic infection. They also used serology to rule out other common parasitic infections.
That can affect the spinal cord, like toxoplasmosis and neosporosis. And finally, to really solidify the diagnosis and visualize the spinal cord, they performed MRI on each dog.
Why was MRI so important for diagnosing SSL?
Well, the MRI scans were really critical for ruling out other conditions that can mimic SSL, like intervertebral disc disease or tumors.
Got it.
The researchers looked for signs of the parasite's migration path within the spinal cord. So things like inflammation, hemorrhage, or even the presence of the larvae themselves.
Wow.
Yeah.
That makes a lot of sense. So by combining the clinical signs, the CSF analysis, the serology, and the MRI findings, they were able to confidently diagnose SSL and rule out other potential causes.
Yeah.
Now, you mentioned a control group earlier.
Yes.
What was the purpose of that group, and what did it reveal?
So the control group in this study was kind of unique.
They weren't there to compare treatment outcomes, but rather to investigate the impact of preventative treatment on the development of SSL.
Yeah.
These dogs had various neurological conditions, but not SSL.
Right.
By comparing the preventative treatment history between the SSL group and the control group, the researchers could gain insights into whether preventatives actually played a role in preventing SSL.
Okay, that's a fascinating approach.
Yeah.
What were the findings when comparing the two groups? Was there a difference in the preventative treatment history?
There was a significant difference. A striking 77% of the dogs in the control group had received preventative treatment for Spirocerca Lupi, compared to only 59% of the dogs in the SSL group. This finding suggests that preventative treatment, while not foolproof, may offer some protection against the development of SSL.
It seems like a valuable insight for vets practicing in areas where Spirocerca Lupi is prevalent. Now, earlier, you mentioned a 0 to 5 severity grading system using the study.
Yes.
Can you just break down what each grade represents clinically?
Sure.
I'm curious to understand how these grades translate into real-world scenarios.
Of course. So grade 0, as you would expect, means the dog showed no neurological deficits. Grade 1 is based solely on back pain, meaning a dog could have significant pain without other neurological deficits and still be classified as grade 1. Grade 2 is characterized by ambulatory paraparesis ataxia or proprioceptive deficits. This indicates that the dog can still walk, but they may have weakness, wobbly hind limbs, or difficulty with spatial awareness.
So those are grades 0 to 2. What about the higher grades? Do grades 3, 4, and 5 represent increasing levels of paralysis?
Exactly. Grade 3 is non-ambulatory paraparesis, meaning the dog is unable to walk using their hind limbs. Grade 4 is full paraplegia, where the hind limbs are completely paralyzed. And lastly, grade 5 represents the most severe presentation with paraplegia and a complete lack of deep pain sensation.
So essentially, the higher the grade, the greater the neurological deficit. It really emphasizes the importance of early intervention and treatment.
Absolutely.
Now, I'm curious to know how these different severity grades related to the outcomes observed in the study.
That's a great question. So the researchers tracked how many dogs fell into each grade and how that related to their recovery. Let's start with the overall positive outcome rate. A remarkable 75% of dogs achieved a positive outcome at the 3-month mark.
That's amazing.
This means that they were ambulatory and they had normal reflexes.
That's an impressive recovery rate.
Yeah.
However, I imagine these numbers varied based on the initial severity grade.
You're absolutely right. The breakdown by grade provides valuable insights. So grade 3, non-ambulatory paraparesis was the most common presentation, accounting for about 60% of the dogs. In this group, 77% of the dogs achieved a positive outcome at 3 months.
That's incredible. Over 3/4 of the dogs that were initially unable to walk were walking again after 3 months.
Yes.
That's really a testament to the potential for recovery even in these severe cases.
Indeed. And while many of these dogs still had a negative outcome at the 1-month mark, meaning they hadn't regained full mobility yet, it's encouraging to note that 64% of those with a negative outcome at 1 month went on to have a positive outcome at 3 months.
So even if a dog wasn't walking after a month, there was still a good chance they would recover with continued treatment and time.
Absolutely.
What about the more severe grades 4 and 5? What are their chances of recovery?
So as expected, the recovery rates were lower for these grades, just reflecting the greater extent of spinal cord damage. In grade 4, complete paraplegia, 42% achieved a positive outcome at 3 months.
Okay.
And for grade 5 paraplegia with no deep pain sensation, the positive outcome rate was 59% at 3 months.
Those numbers are still quite remarkable, considering the severity of those presentations.
They are.
Even in the most severe cases,
Yeah.
there's still a significant chance of recovery.
Right.
That's got to be a powerful message of hope for both vets and dog owners.
Absolutely.
Earlier, you mentioned a link between urinary incontinence and a lower likelihood of full recovery.
Yes.
Can you expand on those findings?
Certainly. So urinary incontinence was documented in about 23% of the dogs in the study.
Okay.
As we discussed, the symptom could indicate more extensive spinal cord damage, making full recovery more challenging.
Right.
The study found that dogs with urinary incontinence were less likely to have a positive outcome at 3 months compared to continent dogs.
That's an important consideration for vets assessing and managing these cases.
Yes.
We've discussed the initial severity grade and urinary incontinence as factors impacting recovery.
Right.
Was there anything else that influenced a dog's chance of recovery?
Yes. The study also found a significant relationship between the number of limbs affected and the likelihood of recovery.
Okay.
The more limbs affected at presentation, the lower the chances of a positive outcome.
Okay.
This is likely due to the greater extent of spinal cord involvement.
So all of these factors, the initial severity, urinary incontinence, and the number of limbs affected, kind of paint a picture of the extent of the spinal cord involvement.
Exactly.
And help guide vets in predicting the likelihood of recovery.
Absolutely.
What about the presence of abnormal spinal reflexes?
Yeah.
Did the study explore that as a potential prognostic indicator?
Interestingly, abnormal spinal reflexes at presentation didn't appear to significantly impact the outcome.
Really?
Yeah. This finding suggests that the presence or absence of abnormal reflexes might not be as reliable a predictor of recovery in SSL as we initially thought.
That's an interesting observation. What about the CSF analysis?
Yeah.
Besides the presence of eosinophils,
Yeah.
did the researchers find any other CSF-related factors linked to prognosis?
Yes, they did.
Okay.
They discovered a strong link
Okay.
between the concentration of protein in the CSF at presentation
Okay.
and the likelihood of recovery.
Okay.
Dogs who recovered had significantly lower protein concentrations in their CSF at presentation compared to those who didn't recover.
So could higher CSF protein levels be a red flag for a worse prognosis?
That's the crux of the matter.
Yeah.
While more research is needed to confirm this, it's a compelling finding that could potentially help veterinarians predict which dogs might face a more challenging recovery journey.
This has been an incredibly informative deep dive.
It has.
We've covered a lot of ground from the unusual presentation of SSL to its diagnosis, treatment, and factors influencing recovery.
Right.
But before we move on, I want to get into the specifics of how this study was actually conducted.
Okay.
Can you talk more about the methodology they used?
Certainly. Let's delve into that.
Perfect.
So the researchers, they were meticulous in their approach. They included dogs with a confirmed diagnosis of SSL based on specific criteria. These dogs had to present with clinical signs of acute and progressive spinal cord disease, which could range from back pain to paralysis.
And confirming those symptoms were due to Spirocerca Lupi and not something else must have been critical.
Right.
What steps did they take to rule out those other potential causes?
They used a combination of diagnostic tools, including CSF analysis, serology, and magnetic resonance imaging, or MRI.
Okay, let's break down each of those. We already discussed the importance of CSF analysis in identifying eosinophils.
Right.
Can you elaborate on the serology testing and what it revealed?
Sure. So serology played a crucial role in excluding other parasitic infections that are known to affect the spinal cord.
So conditions like toxoplasmosis and neosporosis can mimic SSL. So ruling them out was essential.
That makes sense. And how did MRI contribute to confirming the diagnosis of SSL?
Well, MRI provided detailed images of the spinal cord, allowing the researchers to look for specific signs of Spirocerca Lupi migration. They looked for evidence of inflammation, hemorrhage, and even the presence of the larvae themselves. Yeah. And importantly, MRI helped rule out other structural abnormalities like intervertebral disc disease or tumors that could mimic SSL.
So by using this multimodal approach, The researchers were able to confidently attribute the neurological signs to SSL and eliminate other potential causes.
Exactly.
Now, let's talk more about the preventative treatment aspect. You mentioned that the control group was specifically designed to investigate the impact of preventative treatment on the development of SSL.
Yes.
Can you walk us through the types of preventative treatment regimens these dogs were on?
Certainly. So the study looked at various preventative treatment regimens,
including monthly every 2-month and every 3-month administration of medications like doramectin or ivermectin.
And did they find any link between the frequency of preventative treatment and the development of SSL?
Interestingly, the study found no significant association between the specific prophylactic treatment regimen and the outcome at either 1 month or 3 months.
So it seems that once those larvae reach the spinal cord, the frequency of past preventative treatments doesn't necessarily influence the dog's chance of recovery.
Right.
I want to circle back to the severity grading system used in the study.
Okay.
We discussed what each grade represents clinically.
Yes.
But I'm curious to know how those grades impacted the recovery rates observed in the study.
Sure.
Can you provide some more specifics?
Absolutely. Remember that a remarkable 75% of dogs achieved a positive outcome.
Right.
Defined as being ambulatory with normal reflexes at the 3-month mark.
That was an incredible finding.
Yeah.
But I imagine the recovery rates differed depending on the initial severity grade.
You are correct. The breakdown by grade offers valuable insights. Let's start with grade 3.
Okay.
Non-ambulatory paraparesis, which was the most common presentation affecting about 60% of the dogs.
Wow.
In this group, 77% achieved a positive outcome at 3 months.
Okay.
While many of these dogs initially had a negative outcome at 1 month, meaning they weren't yet walking, 64% of those went on to achieve a positive outcome at 3 months.
So even for dogs who were initially paralyzed, there was a significant chance of recovery with continued treatment and time.
Yeah.
What about the more severe, grades 4 and 5?
Yeah.
What were their chances of walking again?
In grade 4 complete paraplegia, 42% of dogs achieved a positive outcome at 3 months.
Okay.
And surprisingly, for grade 5 paraplegia with no deep pain sensation, the positive outcome rate was 59% at 3 months.
It's amazing that even in those most severe cases with a complete loss of deep pain sensation, there was still a chance of regaining mobility.
Yeah, it is quite remarkable.
What factors contributed to those positive outcomes in the higher grades?
While the study didn't delve into the specific reasons for those outcomes, it's likely a combination of factors, including the aggressive treatment protocol, the supportive care, and just the dog's own individual healing capacity.
That makes sense.
Yeah.
Now, we previously discussed the relationship between urinary incontinence and a lower likelihood of full recovery.
Yes.
Can you delve into those findings in more detail?
Certainly. So, urinary incontinence was observed in about 23% of the dogs in the study.
Okay.
And it was significantly associated with a lower likelihood of a positive outcome at 3 months.
I recall that you mentioned this might be due to more extensive spinal cord damage. Is that correct?
Yes, that's the prevailing thought.
Okay.
Damage to the nerve pathways that are responsible for bladder control can significantly impact a dog's ability to regain continence.
Right.
However, it's worth noting that this association wasn't statistically significant at the 1-month mark.
Interesting.
This suggests that some dogs might actually regain bladder control with continued healing and time.
So even in cases of urinary incontinence, there's still potential for improvement.
Right.
It emphasizes the importance of long-term monitoring and continued supportive care.
Absolutely.
Now let's move on to another crucial factor we touched upon earlier, the number of limbs affected at presentation.
Yes.
Can you elaborate on how this impacted the likelihood of recovery?
Absolutely. The study found a very clear trend. The more limbs affected, the lower the chances of a positive outcome.
I imagine this is because a greater number of affected limbs reflects a more widespread area of spinal cord involvement.
Precisely. To illustrate this point, the study found that dogs with only 1 limb affected had a 76% chance of a positive outcome at 3 months.
Okay.
While those with 2 or more limbs affected had a 71% chance.
Okay.
And as I mentioned earlier, all dogs presenting with only back pain and no limb involvement achieved a full recovery at both 1 and 3 months.
This finding underscores the importance of a thorough neurological examination to accurately assess the extent of limb involvement. Did the researchers evaluate other neurological parameters, such as spinal reflexes, to predict recovery?
Yes. They did assess spinal reflexes.
Okay.
However, they found that abnormal spinal reflexes at presentation didn't significantly influence the outcome.
That's a fascinating finding. It challenges the conventional thinking that abnormal reflexes might indicate a poorer prognosis. What are your thoughts on this observation?
Well, it's a reminder that prognostication in neurology can be complex.
Right.
And while clinical signs can definitely help guide us,
Right.
each case has to be evaluated individually, taking all factors into account.
Right.
The presence or absence of abnormal reflexes in SSL might not be as reliable a predictor of recovery as we might initially assume.
That's a valuable perspective.
Yeah.
Now let's shift our focus back to CSF analysis.
Okay.
We've talked extensively about the significance of eosinophils in diagnosing SSL.
Yes.
But did the study uncover any other CSF-related factors that could help predict a dog's chance of recovery?
Yes, they did. The study found a strong association between the concentration of protein in the CSF at presentation and the likelihood of recovery. Dogs who recovered tended to have significantly lower protein concentrations in their CSF compared to those who didn't.
That's an intriguing finding. So elevated CSF protein levels could potentially signal a less favorable prognosis.
That's the burning question, and it certainly warrants further investigation.
Yeah.
While more research is needed to confirm this association, it could prove to be a valuable tool for vets in assessing the severity of spinal cord involvement and guiding treatment decisions.
This deep dive has been incredibly insightful so far.
It has.
We've covered the diagnostic challenges of SSL, the potential benefits and limitations of preventative treatment, and the crucial factors influencing a dog's chance of recovery.
Yes.
Now, I want to shift gears and delve into the specific treatment protocols used in this study.
Of course. Let's explore the treatment aspects in detail. The treatment protocol for dogs with SSL in this study was really multifaceted. It targeted both the parasitic infection and the inflammation in the spinal cord.
Okay, so a two-pronged approach. What medications did they use specifically?
So the primary weapons against the parasite itself were anthelmintic medications, dormectin or ivermectin.
Okay, so the same medications we use for heartworm prevention, but at a higher dose?
Exactly. The dosage in the study was quite aggressive. 400 micrograms per kilogram of body weight every 24 hours for 3 days, followed by weekly doses for 6 weeks.
Wow, that's a lot.
It is. This aggressive approach aimed to eliminate the parasites quickly and effectively.
Makes sense. That's definitely a higher dose than what's typically used for routine preventative treatment. What about the inflammation? How do they address that aspect?
Alongside the anthelmintics, they administered corticosteroids, specifically prednisone, to combat the inflammation caused by the parasite's migration within the spinal cord.
Prednisone is a powerful anti-inflammatory. What's the dosage and duration of treatment?
They administered prednisone orally at a dose of 1 milligram per kilogram of body weight daily, gradually tapering it over 10 to 15 days. This gradual reduction helped control that inflammation while avoiding a rebound effect that can happen with abrupt discontinuation.
So they were hitting the parasite hard and managing the inflammation carefully. I'm guessing supportive care also played a crucial role in these cases.
Absolutely. Supportive care is vital in these cases, and the researchers tailored it to each dog's needs.
What specific supportive measures did they provide?
Supportive care included a 2-week course of clindamycin, an antibiotic, to prevent secondary bacterial infections. They also administered pain relief medications such as gabapentin and dipyrone to keep the dogs comfortable, especially those experiencing severe back pain or nerve-related pain. And finally, they strongly emphasized the importance of early physiotherapy and controlled exercise for all dogs.
Physiotherapy can make a huge difference in neurological recovery.
Oh, absolutely.
What benefits does it offer in these cases?
Well, physiotherapy helps maintain muscle mass, improve circulation, and promote neurological recovery. It's about giving these dogs the best possible chance to regain their strength and mobility. The study's findings highlight the importance of this multifaceted approach to treatment and the remarkable potential for recovery in dogs with SSL.
This has been an eye-opening deep dive into SSL. There's covered so much ground, from the diagnostic nuances to the treatment strategies and prognostic factors. What key takeaways should our listeners, especially those practicing in areas where Spirocerca Lupi is prevalent, keep in mind?
Well, I think the most crucial message is one of hope. Despite its potential severity, SSL often has a favorable outcome with appropriate treatment.
That's great.
Even dogs presenting with paralysis can regain mobility.
That's a powerful and encouraging message for both vets and dog owners facing this challenging condition. What about the role of preventative treatment? What insights does this study offer?
Well, While the study indicates that preventative treatment might not completely eliminate the risk of SSL, it does suggest a protective effect.
Okay.
This really emphasizes the importance of being proactive in those endemic areas.
Right.
And even though it might not be a foolproof solution, the current recommendations for heartworm prevention, which often include medications effective against Spirocerca Lupi, likely offer some degree of protection against this unusual manifestation of the infection.
So while we continue to learn more about SSL and explore potential refinements to preventative strategies, the current guidelines still provide a valuable line of defense.
Absolutely.
What about those cases where SSL is already developed? What advice do you have for vets managing those cases?
Early recognition and aggressive treatment are paramount. Veterinarians need to have SSL on their radar, especially when encountering dogs with those compatible neurological signs in areas where Spirocerca Lupi is common.
Right.
Don't dismiss seemingly minor signs like back pain alone.
Right.
It could be an early warning sign of a much more serious problem.
Right.
Additionally, the study's findings regarding CSF protein concentration could provide really valuable insights into the severity of the spinal cord involvement.
It sounds like CSF protein could be a valuable prognostic indicator, guiding treatment decisions and helping set realistic expectations for owners.
Precisely. While further research is needed to really validate its reliability, it's a very intriguing avenue for future investigation.
Yeah.
This deep dive has really illuminated a fascinating and often misunderstood condition.
It has.
SSL, while potentially devastating, is not a hopeless diagnosis.
That's great.
With early recognition, prompt intervention, and comprehensive care, many dogs can regain their mobility and enjoy a good quality of life. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.